Healthcare professionals work in an exciting and richly rewarding environment. Caring for the sick and healing those in need are responsibilities we don't take lightly. But in the area of prevention of medical errors, an area we do have control over, there's no doubt we could do much, much better.
In the area of prevention of medical errors, unfortunately, we keep making the same mistakes over and over and over again.
Dr. Arnold Mackles is a highly respected physician speaker recognized for delivering energetic and valuable programs that meet regulatory compliance standards. Dr. Mackles has been a practicing neonatal pediatric physician for more than 22 years since completing his fellowship at Cornell University Medical Center, and over that time saw the need to work with healthcare professionals to reduce and eliminate medical errors. Dr. Mackles is also a licensed healthcare risk manager and now travels the country sharing his passion for the prevention of medical errors with healthcare professionals.
Today my topic is prevention of medical errors. But more than that, it really is doctor, tie your shoes before you trip. And what I mean by this is there are many things that we can do as individual physicians to tie our shoes, tie up our loose ends, check our work, make a few little changes in how we practice, and make our practice much safer for ourselves and our patients. But more than just what we can do, it's really what our industry can do. There's a lot of things that we need to do as an industry, as a healthcare industry, to tie up our shoes so we don't trip, so to speak. And the take-home message is not the little details of the definitions or of the laws. The take-home message is really that we have to change the way we look at medical errors and how we treat medical errors.
Not only do we, as healthcare practitioners, have to change, but we must initiate changes in the system as well.
So there are things in the system we can change to make things much safer, and that's the take-home message.
As a speaker and trainer, Dr. Mackles commands immediate respect from his peers because he's a physician and understands those working in the healthcare community and the challenges they face.
During a critical time with the patient, a nurse was handed an unlabeled syringe. The nurse gave it to the patient. It was potassium chloride, and you can likely know what happened after that because the disaster occurred. So what did the hospital do? Well, they pulled the nurse out of the unit. The nurse had to go through all kinds of review boards, almost lost nursing license, lost the position there, and it was just a terrible situation. But the hospital administration thought they did their job. They got the problem out. But they overlooked the big picture. What was the potassium chloride doing there in the first place? Why was an unlabeled syringe given to someone just injected into a patient? They're showing that there's injury in 1 out of 25 hospitalized patients, with an estimated 44,000 to 98,000 deaths per year. Now, in real estate, everyone says location, location, location. What I say in healthcare is communication, communication, communication.
In his lectures and training seminars, Dr. Mackles communicates the need to always be thinking safety, quality, and professionalism in his prevention of medical errors.
I want to talk a little bit about culture. And every industry has its own culture. The auto industry has a culture, the advertising industry has a culture, and the healthcare industry has a culture, though we don't really talk about it very much. And it's my opinion that the healthcare industry culture is not very conducive to preventing medical errors. And I learned my lesson very quickly when I came to the real world to practice. I did my training up in New York at Cornell Medical Center for neonatology, and for 2 years, professors were very, very smart. They knew that interns and residents and fellows can hurt people. So they made us write out all our orders and showing our arithmetic. And the nurses would check our math and then put the order through. So I came my first week from a big city, big academic center, to St. Mary's Hospital in West Palm Beach, Florida, which has a level 3 intensive care unit where they transfer babies in from all, their catchment area. And I was working at 2:30 in the morning my first week, and I was called to a stat C-section at 2:30 in the morning. Mom was premature, she had fever and was suspected chorioamnionitis. Went to the C-section, the baby came out, was slightly premature, about 35, 36 weeks, but was in good shape, was stable. But the mom spiked the fever to 103, and they felt that she probably had acute strep. So we brought the baby into the nursery, did a workup, did a blood culture, spinal tap, and wanted to write antibiotics. So here's my antibiotic order that I wrote. It says ampicillin, 100 milligrams per kilo per day, divided through 12 hours, and I put at the bottom 110 milligrams IV Q12 first dose stat, handed it to the nurse, and I walked away. I thought everything was under control. 5 minutes later, the nurse comes up to me with a very stern look on her face, and she says, "Dr. Mackles, can I trust you?" I said, "Of course you can trust me." She goes, "So why do I have to check your arithmetic? Can't I even trust you to add or divide?" My response was, "It's 2:30 in the morning, I'm tired, this is the way I've been doing it for 2 years. I thought you'd want to check my results to make sure the baby gets the right dosage." Well, she turns around, she sort of shakes her head and walks away, and I knew she was angry, but I figured, well, that's the end of it. They'll just have to learn how I practice. Well, 5 minutes later, the charge nurse comes up to me. And if any of you know charge nurse personalities, they're usually, especially on the night shift, they're usually very strong personalities. Charge nurse has been around for 20, 25 years. They're a no-nonsense kind of person. They want to work the night shift so they don't have to put up with all the administrative things and the routine schedule things that go on during the day. So the charge nurse works up to me. She hands me the chart and says, "Just write the order." And I never wrote another order like that for the next 18 years. Now, in my old age, the last couple of years, when it's late and I have to write a difficult drip for dopamine or epinephrine, I'll go up to the nurse and I'll say, "Would you do me a favor? I'm really tired. Will you check this?" And you know what? They're more than happy to do it. So the good news is, people in the healthcare industry, we're in it because we care. There's a town in Florida where I work, Stewart. It's on the east coast of Florida. And there's a corner there where 7 roads come together as well as the FEC Railroad. And they actually call it Confusion Corner. The people of Stewart don't like change. I don't like change. None of us like to change. It's a very confusing corner, and Department of Transportation will come in frequently and want to modify it into a super intersection with lights and all kinds of gizmos going and ramps. And the people of Stewart revolted. They got up with placards and they had rallies, Save Confusion Corner. And eventually they saved it, and they made a compromise to a very complicated roundabout. I'm telling you this because when things are confusing, many of us like the old way of doing things, even though they're confusing. But when it comes to medicine, and I'm talking about abbreviations, our road signs are abbreviations, we have to change even though we don't want to.
His message is timely and is delivered in an entertaining and highly professional manner. Dr. Arnold Mackles is a physician speaker who not only gets the message out, but gets it across effectively to his audience.